Let me tell you a true story. You are 74 years old, you feel fine, you are sleeping well, you have enough energy to do the things you enjoy. Then you go see your doctor for a routine checkup, nothing special, just the usual. Your doctor looks at your chart and says, "Let me just run a few more tests to be safe." 6 weeks later, you are sitting in a surgeon's office. Not because something was wrong with you, but because those just to be safe tests found something. And that something set off a chain of events that your 74-year-old body was completely unprepared to handle. The life you were enjoying suddenly looks very different. That story happens far more often than the medical system likes to admit. And a study from Harvard Medical School that followed more than 2,000 patients over the age of 70 for 18 months found that nearly 30% of serious medical complications after procedures came from routine screening tests in patients who had no symptoms beforehand. 30%. That is not a small number. So why did nobody tell you this before you signed the consent form? Why in that 15-minute appointment with your doctor did nobody sit down and actually explain what the real risks are at your age? Today, I am going to do that. I am going to walk you through 5 specific medical tests that I, as a doctor, would think very carefully about before getting done after the age of 65. I will explain why the risk equation changes as we get older. I will share real stories from real patients, and at the end of this video, I will give you 5 specific questions you can bring to your next doctor's appointment to completely change that conversation. Stay with me all the way through because number 3 tends to stop people in their tracks the first time they hear it, and number 5 is something most people have never heard of until it is too late. The foundation, why the math changes after 65. Before we get into the 5 tests, I need to share one important way of looking at this with you, because without it, what I am about to say will not fully make sense. I call it the longevity math. When you are 50 years old, early screening works really well. You catch a problem early, you treat it, and you can live another 30 healthy years. That investment is completely worth it. The math is clear. But here is what changes after 65, and more specifically, after 70. 3 things shift at the same time, and they change everything. First, many of the abnormalities that routine screening tests find in older adults will never actually harm you. They grow slowly, they cause no symptoms, and there is a very good chance you will live through them without ever knowing they were there. But once they show up on a test report, medicine does not have a just leave it and watch button. It only has a treat it button. Second, your body's ability to recover decreases with age. A surgery that a 55-year-old bounces back from in 2 weeks, that same surgery in a 78-year-old can mean months of recovery, complications, loss of independence, or worse. Third, there is a phenomenon we call the cascade effect. One test finds a small abnormality. That leads to a follow-up scan. That scan recommends a biopsy. The biopsy leads to a procedure. The procedure causes a complication, and suddenly, a person who walked into the clinic feeling completely fine is dealing with a full-blown medical nightmare, all starting from a test they did not need. Keep that in mind as we go through each one. Test number 1, routine colonoscopy after 75. Let me tell you about Dorothy. Dorothy was 77 years old, a retired librarian in Tennessee. She had had 2 colonoscopies in her 50s and 60s, both completely clean, no polyps, no family history of colon cancer, no symptoms whatsoever. But her new doctor looked at her chart and said it was time for another one. Dorothy had concerns, but she did not want to seem difficult, so she agreed. The prep before the colonoscopy, the liquid you drink overnight to clean out your bowels, hit her kidneys very hard. The next morning she was confused, dizzy, and could barely stand. Her daughter had to rush her to the emergency room before she ever made it to the procedure. She was severely dehydrated, and her electrolytes were so dangerously low that her heart was at risk. Dorothy spent 4 days in the hospital. And the most ironic part of all, she did not need that colonoscopy in the first place. Here's what you need to know. The United States Preventive Services Task Force, the body that sets the national screening guidelines in this country, officially recommends against routine colonoscopy for adults over 75 who are not at high risk. Why? Because the risks clearly begin to outweigh the benefits. And those risks are real. Bowel perforation, meaning an actual tear in your colon, happens in roughly 1 out of every 500 colonoscopies. In a younger person, that is a manageable surgical complication. But in a 77-year-old, it can mean emergency surgery, a temporary colostomy bag, a prolonged hospital stay, and a recovery that completely changes your quality of life. Meanwhile, the colon cancers that these tests typically find in older adults with no symptoms tend to grow very slowly. Slowly enough that in many cases they will never cause any problem in that person's remaining lifetime. So what should you do instead? Ask your doctor about non-invasive stool-based tests like Cologuard or the annual FIT test. These can detect genuine warning signs without the procedural risks. And if you do have symptoms, blood in your stool, unusual changes in your bowel habits, that is an entirely different story. Go see your doctor right away. Test number 2. Aggressive prostate cancer and breast cancer screening in low-risk patients. Let me be very clear here, because this topic requires nuance. I am not saying never check for cancer. Cancer screening has saved millions of lives, and it can absolutely save yours. What I am saying is this. After 75, aggressive cancer screening in people with no symptoms and average risk has a serious problem called overdiagnosis. And overdiagnosis leads directly to overtreatment. What does overdiagnosis mean in plain language? Imaging technology today is so sensitive that it can detect tumors that are biologically almost hibernating. Small, slow-growing, and if left alone, would never spread, never cause any symptoms, and never shorten your life. You would die with them, not from them. But the moment a radiologist writes the word malignant on a report, the clinical machine turns on. Biopsies, specialist referrals, treatment decisions, all moving forward regardless of whether that tumor actually threatens you. Think about a case like Richard's, 79 years old, a retired mechanic in Georgia. Sharp, independent, still going fishing on weekends. His routine PSA came back slightly elevated. A biopsy confirmed a low-grade, slow-growing prostate cancer. His urologist recommended radiation therapy. Richard trusted that recommendation. He went through treatment. Within 1 year, he was dealing with chronic fatigue, urinary problems, and a significantly reduced quality of life. Looking back, he wishes he had understood that his type of cancer was the kind of man his age would almost certainly live alongside, not die from. That understanding, had it come earlier, could have changed everything. A study from the Dana-Farber Cancer Institute followed breast cancer patients over 70 for 24 weeks after diagnosis and found that a significant portion of the cases detected through routine screening were clinically insignificant, meaning the treatment provided no survival benefit, only side effects. So what should you do instead? Have a truly honest conversation with your doctor about your specific risk profile. If you have a family history, genetic markers, or symptoms, screen. But if you are average risk with no symptoms, ask your doctor directly, if we find something, what are the realistic treatment options for someone my age, and what would we most likely recommend? That one question alone often changes the entire conversation. If you are still watching and finding this helpful, go ahead and type the number 2 in the comments. That tells me you are watching and getting value from this video. Test number 3, routine cardiac stress testing without symptoms. This one tends to surprise people because it sounds so logical. Your doctor tells you you are 72 years old. Let us just make sure your heart is doing okay. You walk on a treadmill or they give you medication to temporarily stress your heart and monitor the response. Sounds harmless, sounds responsible. So what is the problem? The problem is that cardiac stress tests in people without symptoms have false positive rates that can reach 40% or higher in certain populations. That means in nearly half of all cases, the test flags an abnormality when your heart is actually perfectly fine. But medicine cannot just shrug at an abnormal result. That false alarm sends you straight to the next step. The next step is cardiac catheterization. Catheterization means threading a thin tube through your blood vessels, usually through your wrist or groin, straight into your heart. This is a serious procedure. Risks include bleeding, blood vessel damage, irregular heart rhythm, and in rare cases, it can actually trigger the very heart attack or stroke you were trying to prevent. And here's where it gets even more counterintuitive. If the catheterization finds a partial blockage, which is extremely common in adults over 70, many of whom have no symptoms at all, you may end up with a cardiac stent. The major ischemia clinical trial, conducted by researchers at NYU Langone Medical Center in collaboration with more than 320 hospitals around the world, following patients for 36 months, found that stenting in patients with stable coronary artery disease did not reduce heart attacks or extend life compared to medication and lifestyle changes alone. Let me say that again. The stent did not help any more than medication, but it carried real risks and then a lifetime of blood thinners with their own bleeding complications. So you have gone from feeling fine to a routine test, to a false alarm, to catheterization, to a stent, to blood thinners, to ongoing monitoring, and statistically, you are no better off than someone who simply managed it with medication and a 30-minute walk every day. So what should you do instead? If you have no chest pain, no unusual shortness of breath, no dizziness during activity, then routine stress testing is searching for problems in a group of people where problems are common but intervention does not always help. Talk to your doctor about optimizing your risk factors instead. Blood pressure, cholesterol, blood sugar, activity level, sleep. That is where the real gains are. Test number 4. Routine DEXA bone density scan with automatic medication. This is the one that tends to make people uncomfortable when I bring it up because osteoporosis is real and falls in older adults can be devastating. So let me be very careful here. I am not denying that bone loss happens with age. What I am questioning is the automatic pipeline that typically follows a DEXA scan result in patients over 75. A DEXA scan finds low bone density. The doctor prescribes a bisphosphonate, medications like alendronate or risedronate. You take them for years assuming you are protected. But here is what often goes unmentioned. Long-term bisphosphonate use has been linked to a rare but serious condition called atypical femoral fractures, meaning spontaneous stress fractures in the thigh bone, the very bone you were trying to protect. These fractures can be severe and require surgery. On top of that, these medications are also linked to osteonecrosis of the jaw, meaning deterioration of the jawbone that is painful and very difficult to treat. Meanwhile, the most effective intervention for preventing fractures in older adults, no medication comes close, is fall prevention. I am talking about balance training. A study from Johns Hopkins School of Medicine following adults over 70 for 20 weeks of regular Tai Chi practice found that fall risk dropped by nearly 47%, nearly half. On top of that, removing tripping hazards from your home, installing grab bars, reviewing any medications that cause dizziness, getting your vision checked regularly, and making sure you have enough protein and vitamin D in your diet. These steps reduce fracture risk more meaningfully than any pill and with zero side effects. I am not saying never take medication for bone health. There are absolutely patients who need it, those who have already had fractures, those with very low T-scores, those with specific risk factors. But a routine DEXA result leading automatically to long-term medication for an active 74-year-old who has never broken a bone and is otherwise healthy is a conversation worth having, not a foregone conclusion. The question you should ask your doctor is, before we talk about medication, can we take a look at my fall risk factors first? And what is the actual fracture risk reduction from this medication compared to a structured fall prevention program? If you have been watching this far and getting value from this video, go ahead and type the number 4 in the comments. That is a simple way to let me know you are here and following along. Test number 5, asymptomatic carotid artery ultrasound screening. This is the one almost nobody is talking about. And based on what the research shows, it is one of the most quietly consequential. A carotid artery ultrasound checks the large blood vessels in your neck that carry blood up to your brain. The idea is straightforward. If we find a significant blockage, we can surgically clear it out and reduce your stroke risk. Sounds logical, right? The reality is far more complicated and for patients without symptoms, far more dangerous than it appears. Here is the key fact. The surgical procedure used to treat a carotid blockage, called a carotid endarterectomy, carries a 2 to 3% risk of causing a stroke during or immediately after the procedure. In older adults, especially those with other health conditions, that risk is even higher. The United States Preventive Services Task Force explicitly recommends against routine carotid artery screening in adults who have no symptoms, no transient ischemic attacks, no brief episodes of vision loss, no neurological symptoms of any kind. Their analysis found that in people without symptoms, the risk of harm from surgery outweighs the benefit. Here is why. Many people over 70 have some degree of narrowing in their carotid arteries. That narrowing has often been there for years, stable, silent, not causing any problems. When you screen for it routinely, you find it. And then a well-meaning surgeon recommends fixing it. But surgery to fix a blockage that was never causing symptoms can sometimes dislodge a tiny piece of plaque that travels straight up to the brain. Medical records document people walking into a routine screening appointment and leaving on a completely different trajectory than they ever imagined, not because of the blockage that was found, but because of the intervention that followed. So what should you do instead? If you have no symptoms of stroke or a transient ischemic attack, no sudden vision changes, no facial drooping, no arm weakness, no sudden severe headache, then routine carotid ultrasound is generally not recommended. A far better investment is in controlling the risk factors that are actually modifiable. High blood pressure is the single biggest driver of stroke. Blood sugar, quitting smoking, managing atrial fibrillation, and staying physically active. If you have any neurological symptoms at all, even brief ones that already resolved, go get evaluated immediately. That changes everything. The practical framework. 5 questions to bring to your doctor. I promised you something you can actually use, so here it is. Every time your doctor recommends a screening test, especially if you are over 70 and feeling well, I want you to have these 5 questions ready. Write them down, save them in your phone, bring them to every appointment. Question number 1 is, what is the false positive rate of this test in people my age? This tells you how likely the test is to pull you into unnecessary follow-up procedures, even when nothing is actually wrong. Question number 2 is, if this test finds something, what are the realistic treatment options for someone my age and in my health condition? This forces the conversation toward outcomes, not just findings. Question number 3 is, what is the procedural risk of any treatment we would most likely pursue? This is the question most people never think to ask. Every procedure carries risk. You deserve to know that up front. Question number 4 is, what happens if we monitor it instead of treating it right away? For many conditions found in older adults, careful, watchful waiting is a valid option and often the better one. Question number 5 is, what is the most effective, non-invasive intervention for this condition? Because very often, as with bone health, heart health, and stroke prevention, lifestyle changes and medication outperform procedural intervention with far lower risk. Any good physician will welcome these questions. They will respect you more for asking them, and if your doctor dismisses these questions or makes you feel difficult for raising them, that is important information about whether that doctor is the right fit for you. There is a difference between medicine that finds things and medicine that helps you live well, and understanding that difference is one of the most valuable things you can do for yourself at this stage of life. After 65, after 70, the goal of your healthcare should not be to generate findings. The goal should be to protect and extend your quality of life, your independence, your energy, your ability to do what matters to you. The best doctors I have ever known understand that sometimes doing less takes more wisdom than doing more. You have the right to know what a test is looking for. You have the right to know what happens if something is found. And you have the right to ask whether that finding would actually improve your life. You deserve a healthcare experience built around your goals, your values, and your body. If this video gave you a new way to think about your health, please share it with your family and loved ones so they can know this too and avoid situations they never should have been in. Give this video a like so it gets recommended to more people who need to hear this. And subscribe so we can meet again at the next piece of advice. See you next time. Take good care of yourselves.